Hello everybody, my name is Joshua Crease. I'm a second year medical student at Anglia Ruskin University in Chelmsford. I've been asked to speak to you about a variety of topics, from getting into medicine, interview tips, and a little bit about me and my journey. First of all, I'll start off by saying that well done. Well done for picking medicine, because personally I believe it is the best field of study you can go for. There is a variety of careers you can go for, and you will have a job for life if you do end up becoming a doctor. A little bit about me personally. So I am a former student at Anglo. I was there all the way from year 7 to year 13. And in sixth form, I chose to study A-level biology, chemistry and economics. I applied to 4 universities for medicine. So that's Anglia Ruskin, St George's, Bristol and Southampton. I was lucky enough to get all 4 offers. Why medicine? Well, I think first of all, it's important to say that getting into medicine is difficult, and rightly so. There's a rigorous process out there. There's so many hurdles to get through, but you do have to remember the nature of the work that doctors undertake, and all in all, patients' lives will be in your hands as a doctor. So there is a rigorous process, and that is right. So before going to your interviews, I think it's really important to have in your mind personally, on a personal level, why you want to be embarking on this career. For me, I think it's developed and changed over time. So perhaps before I went to university, it was more about helping people and enjoying the science side of things. But having been exposed to the clinical side of things, seeing patients, interacting with them, it's changed into a whole lot more for me. And personally, I'm interested now in the holistic approach and caring for patients, not just in the immediate setting, but really transforming their lives and taking away the illness. You've got to remember that the primary role of a doctor is in the relief of suffering. Along with that, I think you need to think about, why do you not want to be going into nursing or paramedicine? Because they help people as well, but they help people in different ways. So perhaps, a bit of research looking at the role of a doctor and how that differs from nursing and paramedicine would be useful prior to going to your interviews. You should have rehearsed the answer to this question before going to your interview, because it's asked everywhere. It's asked all the time. So make sure you've practiced this sort of question, whether it's with your family or on your own, but make sure you have a good answer to this. And I've put here, it's a vocation, it's a job for life. And that's more important than ever. It's very costly to train doctors, and so those who are interviewing you want to know that you're committed and that you'll follow through. So how did I build my application? Well, first of all, I had to make sure that I was academically suited. And what I mean by that is having a look at my grades and being realistic in that, can I achieve the grades that are required for the universities that I want to apply for? So do some research, look at the entry requirements. They will be high for medicine, but have a look realistically at the end of my studies in sixth form, can I achieve those grades? And perhaps it's worth having a chat with Mr. Newton as well, as to whether that's a possibility for you. It's never too early to start preparing. So whether you're in year 10 or 11, or you're in year 12 currently, I think it's really, really useful to start looking up online, start looking at universities that you want to apply for, and also have a look at their application processes. So have a look, how much do they weight on the personal statements? What sort of interview do they do? How much of their UK CAT do they take into consideration? Because it's different for different universities. As part of your application, it's important to have a good balance of things that you can talk about in school and outside of school. So for me personally, inside school, I was a prefect, so I could mention that on my application. I started the Med Society at Anglo. I'm not sure if it's still going, but that was definitely something that I could include on my personal statement. And outside of school, I had sort of 6-7 years in the Air Cadets, which was great for my application because it was a talking point. And as well as that, it showed commitment over time that I was able to commit to, an organisation. For work experience, now this is a touchy topic, especially with COVID times. I think any work experience is great, but they will understand, if you have been limited in terms of COVID. But just remember, your work experience doesn't have to be watching heart transplant surgery or brain surgery. It can be as simple as going to your local elderly home and speaking to residents there. It can be as simple as doing Zoom calls with lonely old people and speaking to them over Zoom. But equally, if you are able to get clinical work experience, then fantastic. Personally, I was able to work with a consultant psychiatrist in East London. And this was just through Googling summer schools to do with medicine. So have a look out there. If you want any more advice on that, then feel free to email me. But it is a touchy topic at the moment. But as I said, it doesn't have to be in a GP or in a hospital setting. It can be lots of different things. It may even be in a hospital setting, but not in a clinical setting. So you could work at the reception, you could volunteer at the reception, or you could work in the shop in the hospital. It's all about getting the experience in the healthcare setting. My personal statement. So personal statements take time to do, and I think getting one written early is good. There was lots of revisions to my personal statement. Mr. Newton's very good with personal statements, especially to do with medicine, and obviously he's had experience being on the interview board there. I think have an idea, have a list of things that you want to include in your personal statement, and just get writing. I'm sure Mr. Newton will agree with me that he will not be upset at looking at personal statements in advance and doing as many revisions as needed. In terms of the UK CAT, hopefully those of you that are applying next academic year, so the deadline will be October, I believe. Hopefully you will be able to do the UK CAT in person. And in terms of any advice to do with that, lots of practice questions. You can find practice questions online in books, but yeah, lots of practice questions. It can be a tricky exam for some people, but identify your weak areas through doing practice and just keep going with that. So top tips for interview. I would definitely recommend researching the university and maybe picking 2 or 3 unique things about the course, whether that's you get to watch a live birth, about dissections. For example, at my university, we get to do full body dissections, whereas some universities only do prosections. So that's part of the cadaver. Or it may be about when you get to go on placement. Do you have to wait till the 3rd year to go on placement, or do you get clinical experience from the 1st year? I think it's important that you practice common questions. So whether this is with your family or on your own, practice, why do you want to go to medicine? Why do you want to go to the specific uni you're applying for? What experience do you have? And the downsides and advantages to becoming a doctor. So they're very key, important questions. Practice those because they do come up time after time. The MMI, so a lot of universities are changing over to MMI interviews. So these are multiple mini interviews with various number of stations. A lot of these stations, or at least a good 3, 4, 5, will be role play stations, depending on the university you apply for. And this can be anything from delivering bad news. So, for example, at St George's, they had an MMI station where I had to deliver bad news to a customer who had just walked into my restaurant and we didn't have any tables left. So it doesn't have to be related to medicine at all. They can choose any scenario they want, but just be prepared and have a look at some of the attributes that a doctor should have and display those in your role play. And finally, just be yourself, but sell yourself. So try and be relaxed. They can tell when you're on edge. They can tell when you're trying to be somebody else, but do try and sell yourself. So don't hold back on qualifications or courses that you've done, because all in all, you are competing with everybody else in the room. So I've been asked to speak quickly about what life is like at medical school and how that differs from sixth form. I'd like to say there is lots of work and we have big exams at the end of the year, no different to sixth form. I like to compare it to a job. So most days I'll be working 9 to 5 with the exception of Wednesdays. And I'll also be doing some independent study in the evenings as well. Obviously, the big change is from classroom-based teaching in sixth form to lecture-based teaching, and that's something that you'll get used to, and it's finding the way you study and take notes, and how that works best for you. Organisation is key. This is one of the big things that Mr. Newton taught me, in that you need to have your schedule organised. You need to make sure you know what's coming up, when you have specific workshops, and when things are due as well. So organise yourself, have a calendar, because that forms the basis for success. And I've put on this slide a typical week, so feel free to pause the video and have a look at that. So you can see it's quite a full-on week, and we have Wednesday afternoons off. So I've been asked to speak a little bit about why ALU. Why did I pick ALU? Well, first of all, I think it's important to say that I was local. So I live in Braintree, ALU's in Chelmsford, so it was ideal for me. And it really does depend whether you want to leave home and you want to live at uni during your studies, or if you're happy staying at home. Personally, my decision was to stay at home and study, and actually that worked out quite well with the pandemic. But that really is a personal choice that you have to make. You can see two pictures on the left-hand side here. So this is the brand new medical school at the top here, and below is the anatomy suite that's found within the building. And this is where we do our dissections of cadavers. For the purpose of the photograph, they've just replaced it with the teaching skeletons we have. But having such a great resource, this anatomy teaching lab, is unique. Not many medical schools will have it, especially one as big as this and the one that has as much technology as this one has. So definitely a selling point for the university for me. Other things was that ALU was offering listing points for local students. So my application would have been put above applications that weren't from the local area. And this is to help for the shortage of GPs in Essex that we currently have. There's a major recruitment drive there. And finally, they were offering lower entry requirements for WAM students. So that's widening access to medicine students. And if you fall within certain categories, you are eligible for lower entry requirements. So have a look for that. It's not just my university that does that. Some others do as well. So that is worth researching. And finally, my future plans. Personally, I'm still unsure about what I want to do. I put a picture here of the Essex Cardiothoracic Centre. So this is the major heart centre in Essex. All of the heart attack patients in Essex get sent here. And it's something that I'm interested in. So it would be cardiology and cardiothoracic surgery. But realistically, I've got so many more modules to go through and lots more clinical work experience in year 4 and 5 of my degree that I'm still unsure. So thank you for listening. Sorry that it's been a bit of a rush. I was asked to keep it to 10 minutes, but we've gone slightly over that. We will have a Q&A on the 23rd of February, which is probably tomorrow for you if this video is put up on the 22nd. So if you do have any questions for then, please feel free to ask me on the day. And I've also popped my email there if you do have any further questions. Thank you for listening.